I am receiving treatment and therefore I cannot spread HIV. This is a bit of a tricky one and it has some nuances to it. So let's try and break it down a little bit so that it kind of makes sense. So when somebody's living with HIV and they're taking their antiretroviral therapy or their ARVs and they're taking them as required, as prescribed, and they have a durably undetectable viral load, they cannot sexually transmit HIV to their partners. And this is a well-established finding. It has been shown in or supported by large clinical studies and also endorsed by major authorities. And essentially, it's that messaging that they call U equals U. Undetectable means untransmittable, right? So as much as U equals U is one of the biggest advances in HIV science, you need to remember that it will depend on having access to the treatment itself. It will depend on adhering to the treatment itself. It will depend on also you being monitored as well. Because remember, you have to be undetectable. And I think the threshold, the last time I checked, it was supposed to be less than 50 copies per milliliter of HIV in your blood, that then you would be deemed as undetectable. So it is also still important to remember that, like, for your sexual health overall, you need to think about other STIs, obviously, and pregnancy prevention if you're not ready for that. But in terms of HIV transmission through sex, effective treatment eliminates that risk.